We're here in the office today with a gentleman who had a history of approximately 5 to 6 years of abdominal wall pain. We're 2 months from removal of several anterior cutaneous branches to the abdominal wall, and we'll explain that more in a little bit. But can you explain to us just a little bit and remind me exactly what your pain was like before we operated on you, before you came to see us? What was your pain like? What was it like living with it? Describe the symptoms to us so we kind of have an idea of what you were going through.
Oh, the pain was constant. It was a constant 8 to 10. And I mean, you couldn't even breathe without being in pain.
And where was your pain specifically?
Right here.
Okay, so your lower abdominal wall, right in front of your belly button or beside your belly button.
Beside where the bag was.
And tell us about the bag. So you had a problem with the colon and you required a diverting colostomy. That means the general surgeon had to take a piece of bowel, lift it up to his abdominal wall, and then in order to vent the stool, that goes into a bag. So that's called a colostomy. And then that, for you, fortunately, was temporary because it's not very pleasant to have, but necessary if we want to survive. But they then reversed your colostomy, which means they close it, sew up the hole, and the bowel movements can now go from the normal anus, and things are supposed to be all better now. So what happened, or what did you feel like after they reversed that colostomy?
Oh, it started out as just a pulling, and I went back and back and back, and they said it's just the way you heal. You have to deal with it.
And at that time you were having intense, sharp pain
all the time,
like electrifying pain or stabbing pain, or how would you describe it?
If I was just laying flat, it would be like a 3-4 and then pulling. But even just to get up and move. And don't cough, don't sneeze.
What happens if you do?
Oh, I mean, the pain will go straight to 10.
And like a giant jolt of electricity, or?
Oh, yeah. It's a crippling pain.
Okay. And how long did you live with that?
5-6 years.
And what did they do for you other than pat you on the back and ask you to hang on? Did they give you medications?
They wanted to prescribe me. They said the only thing I could do was take pain pills.
Okay.
And I will not take pain pills.
Okay.
So I had to live with the pain.
All right. So some pain pills you could take would be the narcotics, of course, and then there's like gabapentin and Lyrica. Did they try those, or did they offer you those medications?
They did, but I can't take Lyrica because the Lyrica affects my depression medicine.
Mm-hmm.
And the gabapentin, in my opinion, is still a narcotic.
Okay. Very good. Well, let me show you what we found here. In a drawing, this is just a textbook of anatomy. And when you do a colostomy, you have to bring the bowel through the rectus abdominis muscle. And in the rectus abdominis muscle, there are these sensory branches. Sensory means they go to the skin. And when we perform a colostomy, we have to split the muscle and pull the bowel through this. And then you have to sew it in place. And then once you remove the colostomy, you have to repair this, again, sewing it in place and creating scar tissue. And so there are going to be a few patients in the world who have these nerves stuck in scar tissue or sutured in a large suture to prevent a hernia, because you don't want the bowels coming back through this unintentionally. And so when we went to the operating room for this gentleman, we identified several branches of these nerves that were stuck in scar tissue, and unfortunately one of them did actually have a suture through it, which again happens, unfortunately, because they're very small. They're less than 1 millimeter in size, and we're not trained to look for these in general surgery to try to avoid them. And so you're now 2 months from this surgery. We took out 2 branches. How do you feel? I mean, and how has the last 2 months been for you?
I have no pain. I could tell the difference as soon as I woke up.
Well, now, granted, we put some numbing medicine in the first, that lasts for about 8 hours. What happened after about 8 hours when the medicine wore off?
The only pain that I had to deal with was just healing from surgery. No pain, nothing.
Would you be willing to show us your scar real quick?
Oh, yeah.
Okay, so this is his incision right here. This is the previous colostomy was a little bit smaller but a lot wider. And then we had to extend the incision medially and laterally just to make sure we got all the branches. And then what we had done, we identified a branch of a nerve here and here that we removed and implanted back into the abdominal wall, into the muscle without a suture around it, trying to place it without tension deep in the muscle belly to try to prevent a recurrent stump neuroma. And so, thank you so much. And so at this time, we're about 2 months out from surgery, and compared to your previous 5 years, how are you feeling? Okay. How are you feeling?
Terrific. I have no pain whatsoever.
Okay.
It's amazing.
Thank you very much. We appreciate that.